Hello. This is the first video for WellSpan Spine Care patients who are getting ready to have surgery. The main goals or objectives of Part 1 are to get you ready for your surgery and let you know what to expect in the hospital when you come in for your surgery. Before you have spine surgery, your surgeon will need you to have some appointments and testing done to make sure that it is safe for you to have surgery. You may need to have an appointment with your primary care doctor, heart doctor, or lung doctor. Your primary care doctor or your surgeon may tell you to stop or change medicines you are taking before surgery. Your surgeon may also order blood work for you to get done or tests like an EKG or chest x-ray. Make sure to have these things done when your surgeon tells you so that your surgery can be scheduled. After your surgery date is scheduled, a nurse will call you to go over important information. This call will take some time and help us learn more about you so your hospital care team can be ready for you. The nurse will go over your health history and the medications you are taking. They will let you know what medicines to take the morning of your surgery and what medicines you should not take on the morning of your surgery. The nurse will make sure that our anesthesia team reviews your history before your surgery. They will also talk to you about your advance directive. An advance directive is a type of plan that lets everyone from your doctors to your family know how you want to be treated if you need medical care and aren't able to choose for yourself. Things can happen between the time you had a phone call from a nurse to the time of your surgery. There are some things we need to know about before your surgery. Letting us know these things will help us keep you safe. We'll need to know about any changes in your health since your last visit to our office. We'll also need to know if you have any changes in your symptoms or any new ones. It will be important to call your surgeon's office if you have had a cold, cough, fever, or any problems with your skin like scrapes, cuts, rashes, bug bites, burns, poison ivy, or any new red areas. Please call your surgeon's office if you notice changes in your health or symptoms, illness, or skin problems. Also, for your safety, please make sure that you do not shave before surgery. You should not shave for 3 days or 72 hours before your surgery. Next, let's talk about how to get your skin ready for surgery. Cleaning your skin is very important before surgery because it will help prevent infection. It can also help you heal faster after surgery. You will get a bottle of surgical scrub from us before surgery that looks something like this. This is a special soap that kills germs to get your skin ready for surgery. You will use half of this bottle when you shower the night before surgery, and the other half when you shower in the morning of your surgery before coming to the hospital. The night before your surgery, take a shower with the shampoo and face wash that you normally use. Clean your hair and wash your face. Make sure to rinse everything off really well. Once you have it all rinsed off, use half of the surgical scrub bottle that was given to you and take about 5 minutes to wash from your neck down. Stay away from your genitals and rectal areas. Once the soap is on, wait 2 minutes before you rinse it off. Dry off with a clean towel after your shower, then get dressed in clean pajamas or sleep clothes. It is important that your bedding is clean. You should not let your pets into your bed the night before surgery. The morning of your surgery, you will need to shower again, just like you did the night before. Dry off with a fresh, clean towel after your shower. Do not put on any lotions, powders, deodorants, perfumes, or makeup after you shower. Get dressed into the clean clothing that you will be wearing to the hospital for your surgery. You will want to wear loose-fitting clothing that is comfortable and easy to take off and put on. We do not recommend that you wear jeans. When you go to the hospital for your surgery, you will want to bring some things with you. It is important that you bring your ID cards and insurance cards. If you wear glasses, you can wear them to the hospital. It helps to bring a case to protect them when you aren't wearing them during surgery. You may also need to bring any personal care items, comfortable clothes, and clothes to sleep in, walking shoes, and important phone numbers you might want or need during your stay. Sometimes patients are fitted for special braces before surgery. If your surgeon recommends a brace and you have one, please bring it with you. If you have a spinal cord stimulator, you will need to bring the remote with you. Without the remote, we cannot turn off your spinal cord stimulator and your surgery will be delayed or canceled. It is important that you write your name on the items you bring with you to the hospital. When you get to the hospital for your surgery, You will be called into the short stay unit. This is where patients get ready for surgery before going into the operating room. While in the short stay unit, you will change into a hospital gown. Your nurse will go over your health history and medications again to make sure you are safe for surgery. They will also start an IV, which is a small tube that is put into a vein for medicines and anesthesia. Your skin may be cleaned again with wipes that have the same type of special soap you used for your showers before surgery. If you are having a surgery that uses any type of implant, like plates, rods, screws, or cages, you may need to have a nasal decolonization. This process uses a solution that we put inside your nose with cotton swabs to kill bacteria. This solution has iodine in it, so it is very important that you tell the nurse if you have an allergy to iodine or shellfish before nasal decolonization. Before surgery, the anesthesiologist and surgeon will come meet with you in the pre-op holding area before you go into the operating room. When it is time for your surgery, your surgical team will take you to the operating room. You will be hooked up to machines and monitors, and your surgery will take place. When your surgery is over, you will be taken to the post-anesthesia care unit. This is also called the PACU. This is where you wake up after surgery. Most patients stay in this area for an hour or two after surgery. This brings us to the end of the first spine surgery video. In the second video, we will talk about what happens in the hospital when you wake up after your surgery and how to care for yourself when you go home. I will see you soon for part 2. Remember to bring prescription items like inhalers, eye drops, or nasal sprays. Bring any shoe or leg orthotics if you use them. If you use a CPAP, bring your CPAP, mask, tubing, and settings.